So there are two shades of the patient. One is very attached, very lovable, and other that during the anger he bites other and hit his head backward when he was in anger. So in 2015, with the old method of prescription, we prescribe with the rubric because mother is not there and we had no history or generational history. So what we have, we prescribed head large, hairy body, desire to play, and moles navy, the birthmark on the left hip. And we prescribed midorinum 200 dry dose. From the 2015 till the time 2000, I think 22, he was on midorinum with very less improvement. The hydrocephalus still there, slight improvement in walking, not much improvement in speaking, not much improvement in intellect, not much improvement in understanding. So what we do now, before understand this, let's understand the disease. So now analyze the case with the new perspective because there is not much mother history. The patient after 4 to 5 years is in 7-8 year old, and with the new understanding, I took only from the pathology because mother is not there, but understand that mother was in very terrible condition and the patient was very hyperactive, very violent, running here and there. There is no foundation. He biting anybody. He destroy the things. The attendant hold the patient tightly to stay him. Very, very hyperactive. He constantly breaking the things, shouting, shrieking. And as we understand in the previous slide, that there are eruptions. The eruptions still continue. And mother leaves him on the 8th day of the pregnancy. And I took the rubric delusion separated word from his and delusion animal he. And we left with germanium mat and chocolate as with the previous history, because now at the 7 or 8 year of age, now he become very violent because now he can run or walk. This is improved with midorinum, but he become very, very, very violent, much more violent from that 2 year of age, and not able to control by the attendants, very destructive. So I observed this and I took this, the animal he is. The consciousness comes down to more lower realm. There is no human mind. There is no restrictions. There is no boundaries how to live or how to survive. And with these two rubrics, some rare remedies are there, but I left with germanium mat and chocolate. And I prescribe him chocolate as he is very playful and affectionate child. So first see the result after the chocolate. So this is the second video of the patient. So what the attendant said, okay, now he is perfectly okay. His head is normal now and he understand the things. He can speak all the things. He conversate very easily to others. Let's see. What he said, okay, he now understand everything. The anger is still there, but now his hydrocephalus gone. His understanding is improved up to 90%. The parents are very happy. Still somewhat shy. Eat by his own. Now he can eat by his own. The child who is nothing at the age of 2 years, and in 2 years after prescribing chocolate, he is safe now.